this is a short video. I'm going to discuss diastasis recti. The diastasis recti is a common complaint during pregnancy. It can also be known as separation of your tummy muscles. So when you're pregnant, from about 8 weeks, a hormone is released called relaxin, and relaxin relaxes and softens your ligaments and the connective tissues around this area of your tummy and your pelvis in order to help you accommodate your baby as your tummy grows, but also to prepare your body for labour as well, as your pelvis needs to widen as well. The diastasis recti is caused by the softening, particularly, of a long piece of tissue down the middle of your tummy called your linea alba, and your tummy muscles usually attach to this long piece of tissue. Now this softens and stretches as your bump gets bigger, and in some ladies this just softens and stretches just that little bit too much, and then your abdominal muscles or your six-pack muscles end up not being exactly where they need to be in order to work properly. So in some ladies, particularly if your tummy muscles are already quite weak, you can experience lower back pain or pelvic pain because your tummy muscles usually work to support and keep all of this really stable. So with certain things such as sitting for long periods of time, or walking, or getting yourself in and out of bed where you use your tummy muscles quite a lot, you can experience some back pain or pelvic pain with those sorts of things. So the other thing that you can sometimes notice with diastasis recti is like a coning or a dome sort of shape in your bump when you go to sit yourself up out of bed or out of the bath as well. So one way that you can help manage diastasis recti symptoms is by looking at your posture. I'm going to talk through good ways to sit, bad ways that you shouldn't be sitting. So you shouldn't really, at work or when you're sat watching TV, for example, be slumped, because that puts a lot of strain on your lower back like this. So what you can do, we don't want you sitting bolt upright as well, okay, and really arching your spine. If you just roll up a small towel and then just put that in the lower part of your back and then relax back into it, it just supports your posture and means that your tummy muscles, your back muscles aren't working quite as hard, and should help prevent any back problems while you're pregnant. I'm just going to demonstrate the best way to be getting in and out of bed to prevent any back or pelvic pain. Sitting on the edge of your bed, okay, you want to lean over onto your side and then ease your legs onto the bed, okay, and then to try and make sure that you're not twisting at your pelvis and your knees. If you just support them by just putting enough pillows in between your knees, just to make sure that your hip and your knee are in line, okay, so you're not putting any extra pressure on. And then to get out of bed, if you wake up on your back, you want to make sure that you don't sit yourself forwards using your tummy muscles. You want to roll over onto your side, so bend your knees up, roll over onto your side, and then if we just move that pillow out of the way, you then want to ease your legs over off the edge of the bed and then push yourself up using your arms, nice and steady, like so, okay. I hope this video has been useful. If you do have any queries, any concerns, then just speak to your midwife, and she'll be able to refer you through to physiotherapy if she feels that it's appropriate.